Victories in the courts have brought a seemingly new era of LGBTQ acceptance. But the big issues, gender discrimination, housing bias, and particularly access to health care, still take a double toll on gay and trans people of color. Tonight, the healthcare needs and issues in Boston's LGBTQ communities of color. Welcome to our 50th season of Basic Black. Some of you are joining us on our live broadcast, and others of you are joining us on Facebook Live. I'm Callie Crossley, host of Under the Radar 89.7. Joining me tonight are Dr. Neelam Vashi, director of the BU Center for Ethnic Skin, and a member of the Center for Transgender Medicine and Surgery at Boston Medical Center. Dwayne Steward, director of Community Affairs at Fenway Health. Dr. Madina Agenor, assistant professor of social and behavioral sciences at Harvard's T.H. Chan School of Public Health, and Chastity Bowick, director of the Transgender Emergency Fund of Massachusetts. Welcome to all of you.
Thank you for having me.
I'm going to start with a saying that I bet all of you all know, and that is, if white America catches a cold, black America gets pneumonia. Y'all heard that?
I have.
So that's a significant statement about always the heavy impact of not just healthcare issues, but certainly that's a big one about how it happens for folks of color. It's always heavier and more detailed and more significant. So I want to go around and ask each of you to name the key issue that you think is critical right now as gay and trans people in healthcare try to find access, try to get their needs met. Whatever you think is something that people should know. I'll start with you, Doctor.
Sure. So I think there's a couple facets to this. So, the LGBT community is a vulnerable population, and there's some literature that shows that there's been hostility and insensitivity towards this community. And then the other layer to it is that people of color are also a vulnerable population. So when we have this double layer, there can be a delay in healthcare. This patient population may be more hesitant to go see the physician out of fear of not being accepted. And this can lead to poor lifestyle choices, poor health outcomes, and then just a worse overall quality of life.
So Chastity, you work with trans people. What do you think is a key issue?
Well, besides from working with trans people and identifying as a, black trans woman, right now we're struggling with housing in the greater Boston area. And our housing needs are tied into our medical needs. Because if you're homeless on the streets, you're not going to be thinking about, your health care. When is my next medical appointment? You're going to be thinking about where is my next meal coming from? So until we can bridge that gap between housing and health care, we're going to continue to have this problem within the trans community.
And the percentages of homeless trans people quite high.
Yes. Mm-hmm. It's extremely high. I would say about 80% of my clients that I see are homeless. And that's an issue. And within homelessness, we already have high HIV rates within the transgender community, but nobody is addressing the other barriers around that. And so until we can get people at the table that look like me and who can make these decisions to bridge this gap, we're going to continue to see this issue.
So Madina, Dr. Madina, what do you say?
So I think that's a really good point that Chastity just raised, because what the research clearly shows is that social determinants of health, discrimination in a whole host of areas, including housing, employment, health care, also policing, really have an undue burden on LGBTQ people of color. And the social determinants of health really affect health through two major pathways. The first is by creating stress that negatively impacts people's mental health and physical health through wear and tear. And then the second way is by undermining access to resources that people need to lead healthy lives, including housing, including healthcare, including stable employment.
And in fact, you've said that the data is just not there. So you can't even design policy because there's not enough data.
That's right. That's right. The research, I would say, is catching up in terms of addressing the needs of LGBTQ people of color in particular. The vast majority of the research on LGBTQ health and healthcare has been done among predominantly white populations. And we are, just starting to get research that includes and also centers LGBTQ people of color so that our needs can be made visible and addressed through policies, programs, and other interventions.
So now, Dwayne, you are working at Fenway Health. That's one of the largest and oldest organizations dealing with gay and trans folk, with a focus on HIV and AIDS and health issues. But still, you've seen the long projection over time. And people still are now at the point thinking, well, aren't you all, isn't it great now? There's more acceptance. Speak about the critical issues that you still see.
Yeah, I mean, we have definitely come to a place in our society where, LGBT folks are more accepted, with the passage of gay marriage, with, the repeal of Don't Ask, Don't Tell. We are unfortunately at a moment where we're seeing some regression in that regard. But people feel like the fight is over in many circumstances, but it's really about those social determinants of health and people who are really at the intersections of multiple identities that are marginalized, such as, a Black trans woman who is dealing with racism, also dealing with sexism, as well as transphobia. And when you have these kind of multiple intersections happening, multiple kind of oppressions happening, that leads to kind of what Madina was saying about, the minority stress compounds and leads to larger health outcomes. And, we also are dealing still with a lot of discrimination in healthcare that is keeping a lot of people from seeking services. So I think access is really one of the major issues, and we really have to focus on getting at these social determinants of health, especially amongst the most marginalized communities and LGBT communities.
So let me ask you the political question, because under President Obama, there was some expansion of programs, and that was a part of this victories in the court and people a little bit more acceptance. This is not to suggest to anybody's listening that all discrimination is over. We need to be clear about that. And as we've said, it's harder for folks of color. But there was some expansion and some paying attention. Now President Trump, while he was on the campaign trail, he's holding up pride signs. He's saying, "You're my people." But he's come in and he's appointed this guy, Roger Severino, head of the Conscious and Religious Freedom Department, as a part of the Civil Rights Department, I would note, who's saying, well, these folks really don't need any extra care, and it should be okay for folks to refuse to care for them because that's part of their consciousness and freedom. Talk about what that impact looks like across the board. Doctor, I'll start with you.
Sure. So I guess I would like to bring up that just because this is done and there's this regulatory body that makes it maybe seemingly okay to deny care for a moral or religious belief, it doesn't necessarily mean that a medical provider will do that. And so
will do what? Refuse?
Refuse.
Okay.
Yes,
okay.
just, and my feelings are, when we become physicians, we take an oath. And an oath is our Hippocratic oath to uphold certain ethical standards. And we choose to prevent disease and treat disease. And part of the oath is to treat everyone with warmth, sympathy, and understanding. So I believe in this oath, and I think that, as physicians, we generally want to make people better, and we want to provide treatments in which the benefits outweigh the risks, and more so in medical curriculums. There's courses on ethics, vulnerable populations. So I think more and more, and you mentioned it also, that the awareness is out there and about these certain populations. So, it's a hope in that as America changes and there's more education, there's a transfer of knowledge, that people will behave in the best way and treat everyone with fairness and equality.
What have you seen as the impact of the Trump administration's change in policy?
Mm-hmm. So from a research perspective, as a researcher, one thing that we were very concerned about was when sexual orientation was removed from some of the national surveys. So there was a survey actually of elders where there was a push to try to remove sexual orientation from the survey. And with the Obama administration, we were actually very close to actually getting gender identity also on the national surveys, which would have allowed us to identify transgender people, identify trans people's healthcare needs and health statuses to then mobilize resources to address them. So that is something that appears to have stalled. And so there's a concern because when you don't have data, basically you don't have a problem, and therefore people can ignore the issues and not allocate resources. So that was something we were concerned about in the research community. In terms of the policy piece, I think that there's still quite a bit of work to be done around access to care, like Dwayne said, and also to providing high quality care that takes into account patients' unique lived experiences and needs. Specifically, there seems to be a movement with some healthcare organizations to address the specific needs of LGBTQ people of color by engaging people in shared decision-making, patient-centered care, and those are all things that would be undermined by policies that don't take into account the unique needs of LGBTQ people in general and LGBTQ people of color in particular.
Well, Chastity, there's been particular pushback against trans folks as they've had their voices out and said this is what's happening to us. And I'm wondering if there is a specific piece of the Trump administration's change in direction that you can feel every day in your work.
Definitely. I feel as though ever since he has been in office, people now feel like they have a right to say certain things to us and do certain things to us. So after that election, most of my clients were coming in, seeing me crying, asking me what should I do, what kind of weapons are illegal to carry on me, because he put our lives that are already at risk and even more at risk, by his nature, his tone, the things that he says. In the healthcare piece, it really affects us a lot because Obamacare and the care that we have here in Massachusetts, we have like one of the best care for transgender individuals in the country. And to see that, have the fear that that might be taken away from people. People now think about committing suicide because I may not be able to have this surgery. They might take this health care away. So it's like we're fighting already, for our rights in society, and now we got to fight with the person who's supposed to be protecting us. So it's very difficult for some of us to even comprehend. And
Dwayne, what is the impact, the concrete impact of the Trump administration's change?
Yeah, the Fenway Institute at Fenway Health, which is the research arm that focuses on policy, education, training, and research, we recently released a policy brief that was focused on kind of over the past year what has been Trump's impact on LGBT healthcare in general, and it's a pretty bleak picture. And so thinking just about the trans military ban, what Madina was saying earlier about the issues surrounding the policies that she was talking about. There's just several at every single turn you're seeing that there's this regression that I kind of mentioned earlier, and some of the major issues around that are really just focused around, again, like Chastity was saying, his tone. And there was a stark increase in the number of people who were reporting violence that was happening against transgender folks, against LGBT people, and also people of color. And so, what people don't realize that what people see on TV, what happens at the top, what the people are saying in our government, it really does affect how people live their daily lives and how they're affected, and how they're able to operate in society.
We should note that there was a spate, and there continues to be, of deaths, attacks on transgender women particularly, across the country, not just everywhere. So here we are in Massachusetts, which was forward-thinking, first state to approve same-sex marriage. We've got some other laws and bills that offer protections. But we're having a conversation that probably could not have happened even just a few years ago to talk about folks of color who are gay and trans. And I wonder if you all could speak to is there a relief and awareness because we're sitting here able to talk openly in ways that we couldn't before that has made a difference? I'll talk with you, Dr.
Yeah,
Stewart.
definitely. I think that's, the key to embracing this culture and this group of people is this awareness, this openness. We see it in social media. We see it on this transferring of knowledge on different media.
And let me interrupt you to say, my point was that this has been an issue, one of you mentioned it, about for folks of color pushing back. That's what I want to put on the table because this is what we're talking about here. So it's not like there is just simply some white discrimination. There are a number of black folks, though I have to say the way it's been portrayed is like homophobia is some unique black thing. And
Right.
I would like you all to address that too. So continue, Doctor.
Yeah, so I guess I was just saying that I think it's important to have the awareness. I think it's important to have this transfer of knowledge so that we can be embracing of this community of people so they can have access to health care and they don't feel like that they will be discriminated against and be treated with insensitivity.
Do you see the change in your patient population with families and friends and I'm talking
Yes.
about, your folks of color?
I do. I have found that I have a lot of patients who are transgender, quite a few, and big range of age and race and also social support. But more and more I'm seeing people coming in with family members, with friends, and everyone is very supportive of the change that they want to go through.
That's important.
great.
Dwayne?
Yeah, I mean, I think that it is a misnomer that, that black folks are more homophobic than others. I think really when you think about it, I think it's really the institutional oppression that's the main problem when we look at LGBTQ people of color. So this week actually was National Black HIV/AIDS Awareness Day on Wednesday, and a lot of the focus nationally has been on this fact that 40% of people who have HIV are African, over 40% are African American, but yet when you look at the statistics of people who are using services to like pre-exposure prophylaxis that you can take every day to prevent HIV, folks who are in treatment to be in care, and what we call treatment as prevention when you're in care, and that reduces your risk of passing HIV to others. The numbers for black folks are really low, the people who are actually accessing these services. And so there's a disconnect when it comes to healthcare systems and people accessing healthcare. And when you think about the kind of modern day HIV fight, it really needs to come from a place of racial justice. Like it needs to center around these folks who are disproportionately affected.
And is that because people are not aware or people are afraid to come? Because to come to one of your programs, you have to step out, right?
True, and I think that it's a lot of different things, and it's really about access. It's about the way that we market different services to the community, thinking like the way that research is done on communities and how research does typically start with white communities.
And trickle down.
Right,
Allegedly.
exactly.
Yeah,
So there really needs to be, when we think about strategy when it comes to public health, people of color, folks who are at the intersections, they need to be at the center as opposed to being afterthoughts.
And the margins. Chastity.
I can say that, sitting here today, I don't really feel like within the trans scope of things, we've gotten very far. We just had a law passed last year for public accommodations, and now it's going to be up on the ballot this year for 2018. This is law that is protecting my rights, that if I want to go out to eat with my coworker, Dwayne, the manager can't tell me to get out because I identify as transgender. So to see that there's so many people within the state that still want to oppose this law, is appalling, because we were a forward-thinking state when it came to transgender rights. And when you talk about homophobia, I'm more in the sense of transphobia. And within the black community, unfortunately, there is a lot of transphobia. Some people still don't understand the difference of being trans or being gay, or even knowing that a transgender woman has the option to be a lesbian or straight. You know what I mean? It's institutionalized, like Dwayne said. So I think is that we have so much more to do before people can even understand the difference between the two, even within our own culture. And I think it's up to us as Black individuals to go out there and educate. Like Dwayne's saying, people don't even know about some of these services that we offer for like PrEP. But who's going to educate them? I don't think the white man is going to educate them. So it's going to have to be up to us to go out in these streets, go out to the urban areas that nobody else wants to go to, and educate our people so we can start seeing these HIV rates within the Black community drop.
Yes, so 2 points that I wanted to make. The first is that state policies really matter for health. And the research is really clear that when states have supportive policies, either in the area of health or social services, the health of LGBTQ people is better. So for example, in states that had same-sex marriage, there's evidence that LGBTQ youth were less likely to commit suicide than in states that didn't have same-sex marriage. And similarly with racial justice policies, we know that that contributes to creating healthier environments for Black people and people of color. Part of the issue with the research, though, is that no study to date has looked at how both sexual orientation justice and racial justice policies can come together to promote the health of LGBTQ people of color. And that's actually a project that I'm working on with some colleagues right now to try to map that out, like Dwayne was saying, centering LGBTQ people of color. And there has been a movement in the research field to think about intersectionality in LGBTQ health. And so that has led to still small, but somewhat increased body of work around LGBTQ people of color. Now, the thing, though, that I think is important for us to think about as researchers, and back to what Dwayne was saying, is that we really need to think about the communities that we're working with when we're doing this research, and engaging community organizations that serve LGBTQ people of color, because that's really who's leading the work and who's leading the fight. And they're the reason why we're able to be here today to talk about this, because of the activism of LGBTQ people of color and organizations and activists who have gotten us to this place. And we need to make sure that they're partners in our research.
So media, pop culture is now out there with some images that we wouldn't have seen. So we just had winning the Oscar film Moonlight which was a love story between two persons of color, men. And then on Empire, there are any number of folks who are across the spectrum. Right now in the documentary feature category, there is Strong Island, which is the journey of a trans man. And so there is a lot out here for people to sort of absorb and think about whether or not it's meaningful in their lives. Does this help?
Yes, I do think it helps. Just like any kind of awareness and information helps, and people can see that these people are just like you and us, and they exist, and they have health issues, and they have love interests, and it opens up a dialogue between people and increases awareness. And I definitely think it helps in just being open to this community of people.
And to note that the creators of Black Lives Matter are all 3 gay trans women, Black women. I think that was a shock to a lot of people, Dwayne.
No, I think they're queer women of color.
Yeah.
But
yes. Yes.
They're. I don't know if they identify as trans, but
yeah.
I think that's a point that a lot of people don't know about, is that when we think about the civil rights movement, when we think about movements that are typically about people of color, we don't think about the people who were LGBT in those fights. There's Bayard Rustin,
right,
who is
organized the March on Washington.
Right,
yes.
Organized the March on Washington. He was, in the inner circle of Martin Luther King. It was in because of the work he did. I Have a Dream speech, and so we don't think about a lot of the leaders who have been a part of this movement, and now, thankfully, Black Lives Matter, most of the leadership are folks who identify somewhere on the spectrum. There are several trans folks who are leading Black Lives Matter sites or organizations around the country. And I think people, when Dre, I forgot his last name.
Dre McKesson.
When he came out of the closet, people thought that was a big shock. But I think, people, I think there's just an unawareness, I think, for people. And when we think about movements of people of color, there have always been queer folks who have been a part of that conversation.
Yet there was a time when people, queer people would not be buried in, people refused to bury them, acknowledge it, or whatever in our families, because that's just what it was all about. Part of the changing in the culture are some of the language that I think a lot of people struggle with. So Chastity, you were saying, we're out here, that's what you were saying, people need to understand that. But I want to talk about the pronouns and how we identify and what that means to people, because that's important stuff. And we're going to do that in Facebook Live. So this is the end of our broadcast. Thanks to all of our guests, all of you, for joining us. And stay with us right now, all of you watching on Facebook Live, as we continue our conversation on Facebook.